Well, good afternoon, everyone. My name is Sean Egan. I'm the Director of COVID Workplace Safety for the state of Michigan and Deputy Director for Labor in the Michigan Department of Labor and Economic Opportunity. I appreciate you taking the time today to jump on our webinar today. We're focusing specifically on the Kalamazoo area as well as Western Michigan University. As you know, we're all facing some milestones in our fight against COVID over the coming weeks, and that includes college students returning to campuses. We're going to work through some of our information that we have available for you, and then we are going to move into a question and answer period. So if you do have questions during the presentation, please make sure that you submit them through the Q&A function on the Microsoft Teams. You can usually find that at the bottom of your screen. We'll get to as many questions as we can, but as you can imagine, with a limited schedule, we probably won't get to them all. We have several of these events coming up where you can tune into, so hopefully we'll be able to get through most of the questions and get you some information that you need. We really wanted to look at college towns because of their unique nature and some of the challenges it creates. Now, certainly businesses across the state of Michigan are dealing with all of the same challenges with COVID, but in a college setting in particular, we have a large group of people coming into typically a small area or a whole lot of people focused in and around a college campus, and that creates large volumes that we really have to focus in on. Now, I can tell you that the governor has convened, and we have worked with a lot of colleges and universities across the state of Michigan on what their plans are. And they are doing a lot of planning to make sure that they can get people to campus and keep them on campus in the face of COVID. And that does create some unique challenges. We need to have that same commitment from our communities as we move forward together to recognize that we all have a role to play, and we have to take ownership of containing COVID to make sure that we get open and we stay open. Many of the challenges that we're seeing are the result of our own behaviors as humans, and we need to make sure that we take ownership and control of the things that we can control. And we need everyone in these college towns and across the state of Michigan to engage fully and think through not just what I must do, but what I can do to make sure that we contain COVID, because every little step is going to make a big impact, and the goal is to get open and stay open. And when we see community transmission, we put our Department of Health and Human Services as well as the governor in a very difficult position. So doing our part will help us contain the spread of COVID and make sure that we can continue to function to the maximum extent possible and keep people working and keep businesses doing business. So you're going to make that difference in getting us open and staying open. And we're going to talk today about many of the things that you must do. And I want you to really be focused in on what else you can do to make sure that you're making a difference in your community and making a difference in our efforts to contain COVID. Everybody's going to have to play a part here, because when we have an outbreak, if it's in one location, it's going to spread, and that makes it very difficult to make sure that everybody in that community can continue to engage at the level that we need to engage. And when we focus in on Kalamazoo and Western Michigan, for sure, we can see the cases. You have this data. In Michigan, we've had almost 88,000 cases, about 1,500 or so just in Kalamazoo County. Now, if you expand that out to the region, it's much higher, of course, but just in Kalamazoo County, that's what we're focused in on. And we wanted to look at college campuses in particular, because if you see on the right-hand side, about 24% of those cases are coming in that 20 to 29 age group, which is largely the college campus life, right? And if we throw the just younger than that on there too, that number gets a little bit bigger. So we really all have to take a step back here and think about how we're going to engage colleges, how we're going to engage this group of people and maximize the things that we're doing to make sure that we can keep things moving forward. One of the things that you're all quite familiar with now is the masking requirements that the governor put into place a few weeks ago. We're really hopeful that if we really get strong compliance with this, that we'll start to see those numbers continue to fall and get us to a point where we can feel much more comfortable engaging in our community. One of the reasons the masking is so critical is that 40% of those who have COVID may be asymptomatic. Another large percentage will be pre-symptomatic that can continue to spread the virus. So think about the number of people that are out and about in our community and feel fine. Any of us right now could be carrying this virus and feel absolutely fine and be transmitting that in our communities. And we know that by wearing the mask, some of the science tells us that we may cut transmission by around 70%. So the masking requirement was put into place recognizing that this is a huge tool in getting us to help fight the spread of COVID. And you can see with this graph here that's available on our website and information from DHHS that our risk of transmission when we had stay home, stay safe is practically none because we're not engaging. It's lowest when we are wearing face coverings and social distancing, and it still remains low when we're both just wearing masks. When we have one or the other, we really start to get into challenges there. So while there's a 24/7 news cycle and we're hearing a lot of noise about COVID, some of these pieces have remained exactly the same throughout. That's social distancing, because this primarily spreads from large respiratory droplets and aerosols we create when we talk, cough, sneeze, or if we yell or sing, more droplets come out. So social distancing helps to disperse those before they can get to the next person. And then face coverings will help bring that transmission distance way down if we're wearing appropriate masks. So these are the keys that we really have to focus in on. And then finally, good hygiene. We can still get the virus if we touch it and touch our eyes, nose, and mouth, some of those places where the virus can get into our bodies and spread. So this masking component is huge, and we need to really focus in on it. And hopefully you're all taking it very serious and making sure that you're requiring the use. There are other tools and responsibilities that we expect to reopen and operate safely. And certainly those are making sure that we are following all the executive orders, that you're making a good faith effort to adhere to the guidelines, and that you're doing training and other tools with your employees so they understand their responsibility and their role in containing COVID. Certainly you can go to the Michigan Safe Start. You can find that at Michigan.gov/coronavirus. And there's a lot of great information there for you to make sure that you are doing all the things that you can do in your business and in your life to make sure we're containing COVID. There are about 8 steps that you need to take to keep workers and customers safe from COVID. And among those, which we'll get into a little bit, are the engineering and administrative controls. So that is like safety speak for engineering are more permanent things like those physical barriers, changes to ventilation, moving production lines or other things, rearranging. Administrative controls are those things that you do administratively, which would be like the health screenings, the leave policies, staggering breaks, lunch times, changing your shift schedules, those types of things. Access controls are those things on how you monitor and control access into your environment for non-public facing businesses that don't generally have themselves open to the public. That would be scheduling appointments, kind of locking the doors except for people that are coming in. Those health screening components to make sure that as your employees or visitors come in, they've been screened for symptoms of COVID. Distancing works, as I mentioned, is one of the primary tools for containing COVID, making sure that your workspaces are 6 feet or more apart, making sure that tables in the restaurants are 6 feet or more apart, sanitation, doing that cleaning and other things as prescribed by the CDC as well as the executive orders. Practicing good hygiene and promoting good hygiene. This means giving workers extra time to make sure they're washing up and making sure that everybody understands how critical this is to use that hand sanitizer that's effective and washing your hands frequently. PPE and face coverings are tools, like I mentioned, that will help prevent the transmission of COVID and can cut the transmission significantly, which is why it's so critical that in public-facing businesses that you're requiring customers to wear those if they're medically able or don't fit one of the other exceptions when they're coming into your location, because that's really going to help us control how much this spreads in the community. What we do in positive case protocols, reporting to public health, contact tracing with your employees, contact tracing the best that you can with your customers, to make sure that we're spotting and letting people know that they've been exposed to COVID, and doing those deep cleanings and other things necessary. And if necessary, a facility closure to do those deep cleaning and other things to make sure that we are containing COVID and stopping that spread within the workplace. So in the bar and restaurant space specifically, we have these great tools that are available on a website I'll share later that you can use, you can post, you can provide them to your employees or customers just to kind of give you an idea. So here we go.
For food service employees and their employers, there are new ways to work safely to help reduce the spread of COVID-19. Designate one or more worksite supervisors to implement, monitor, and report on the COVID-19 preparedness and response plan. Develop daily entry screening protocol for employees and contractors. Display a door or sidewalk sign with the services available, instructions for pickup, and hours of operation. Reserve parking spaces near the front door for curbside pickup only. Limit capacity to 50% of normal seating. Require 6 feet of separation between parties or groups at different tables or bar tops. Close waiting areas and ask customers to wait in cars for a call when their table is ready. Create or post communication materials for customers, including instructing customers to wear a face covering or mask until they are seated. Close self-serve food or drink options, such as buffets, salad bars, and drink stations. Require hosts and servers to wear face coverings. Food preparers should wear face coverings and gloves in the kitchen area when handling food. Install physical barriers such as sneeze guards and partitions at cash registers, bars, host stands, and other areas where maintaining physical distance of 6 feet is difficult. Limit number of employees in shared spaces. Provide physical guides such as tape on floors or sidewalks and signage on walls to ensure that customers remain at least 6 feet apart in any lines. And wherever you work, here are some guidelines and safety precautions for you to do your part in reducing the spread of COVID-19. Limit close contact with others by maintaining a distance of at least 6 feet when possible. Minimize handling of cash, credit cards, and mobile devices, and wash or sanitize your hands after handling. Practice routine cleaning and disinfection of frequently touched surfaces and tools. Wash your hands regularly with soap and water for at least 20 seconds. Avoid touching your eyes, nose, or mouth. And be sure to follow these safety precautions. Wear face coverings or masks. Check for symptoms that often include fever or abnormal cough or shortness of breath. Stay home if you are sick or have been in close contact with someone who is sick. Report your diagnostic test results and exposures to your employer, and participate honestly and urgently in workplace safety training. For additional resources, visit Michigan.gov/MIOSHA.
So if you think about that video and some of the things that we're going to be talking about and some of the questions that we'll take, as you can see, that social distancing, right? One of those primary tools that I mentioned are what we're thinking about. So in your bar or restaurant, making sure those tables are spaced, but don't forget about people waiting to come in. You should be closing your waiting areas and making sure, calling people to come in when there's space available, but don't forget about all those folks that might gather outside and how you might handle something like that. And then those face coverings and other pieces when we can't maintain that 6 feet of social distance are what are so critical. So we have information. Some of this information is relatively generic, and when we get into the FAQs, we'll probably hone in on some concepts. But we have available for every industry that's been named in an executive order, guidelines created by MIOSHA that might have some more restrictive components depending on your type of industry that were within the executive orders. And they also include CDC guidance and other tools that you can use to make sure that you're doing everything that you can. But I don't want you to just look at those, and I'm going to keep bringing this up and think about, like, this is all I need to do. Keep thinking about the next thing that you might be able to do, like how you're going to deal with those folks that might gather outside your establishment, how you're going to limit the number of people trying to come at any one given time, and other things that you can do. But there's also other restrictions. So indoor service is restricted at bars and restaurants to those that earn more than 70% of their gross receipts from alcohol sales. So if you earn more than 70%, and we have Barb Sebastian from Lara that's going to help us with this concept, of your revenue from alcohol sales, you're going to need to not be open, and she's going to share what that means. We also have a nice Safe Start map info that has regional information about what can and cannot be open that you can refer to. So we have Randy Langford with us today from the State Fire Marshal that's going to talk about some of those other things that I haven't touched on yet, which include capacity limits and some of those other pieces. So I'll turn it over to you, Randy.
Thank you, Sean. It's good to be here today. I'm the region supervisor for the State Fire Marshal's office, which includes 13 counties in Southwest Michigan, including the Kalamazoo and metropolitan area. So I'm the field person that gets involved with any fire safety issues that the state regulates. Now, the Bureau of Fire Services has authority over colleges, university classrooms, and dormitories. Primarily, that's construction, complaints, things of that nature, but also public areas of public assemblage, which is restaurants, bars, and movie theaters. Our rules are real general. They deal with maintenance of those facilities primarily. We do work with the local jurisdictions, fire marshals, fire departments in those assembly areas, because they're the ones that primarily as fire departments would respond to fires and things of that nature in those types of facilities. So our role is to coordinate in those facilities with the local jurisdictions. Our goal, if we have complaints, we're dealing with bars and restaurants and movie theaters, etc., is really to educate before we regulate. So if we get a complaint on a facility of that type, our role is going to be coordination with the local jurisdiction and attempting to educate the owners of these facilities if we have a problem, if they need assistance. We work with the local jurisdictions, the fire marshal's offices, or the fire departments in those jurisdictions to resolve those. We get involved with issues over occupant loads of buildings and calculating the occupant loads if they're not already posted. The majority of our assemblies are already posted for occupant load, so that at least gives some starting point in dealing with how many people are allowed in that facility during normal operations. Obviously, we're going to have some reductions here with the COVID issues. So we will work with the business and the local fire jurisdictions to try to resolve capacity issues, any other types of things that come up. And we do have a phone number for you to call if you have questions or concerns related to fire safety issues in any of these facilities. It's 517-388-1761. Sean, I think that's all I have, until we get to questions probably.
Okay, thank you, Randy. And I know that a lot of folks have questions with the Liquor Control Commission and some of the things that Laura might be doing with licensing. So Barb Sebastian's here today to help us work through some of those. Go ahead, Barb.
Good afternoon. Thank you. I'm Barb Sebastian. I'm one of the regional managers for the Enforcement Division of the Liquor Control Commission, and we are responsible for enforcing laws and rules at bars, restaurants, stores, distillers, bowling alleys, all kinds of places that have a liquor license. We're also enforcing the executive orders. We have been checking businesses to ensure that they're in compliance with all those requirements. Like the Bureau of Fire Safety, we are trying to educate whenever possible. We are taking action in cases where people are disregarding the laws and rules and putting the public, their employees, or our staff at risk. We do provide education to licensees to let them know what's expected of them. We have lots of great information on our website. It's updated regularly with new executive order information, COVID information, reopening resources, all kinds of information there. Our web address is www.michigan.gov/LCC, and you're welcome to take advantage of any of the resources there. We also work with local police, and we provide them with funds to enforce the liquor code and rules and the executive orders. So they're out there as well, making sure the licensees are in compliance. If you have any questions for the Enforcement Division, you can reach me by email, and my email address is on the slide right now that you're looking at. Be happy to help you out with that. Just a couple quick things to let you know what our concerns and focuses are right now. We are committed at the Liquor Commission to helping licensees get open and stay open. We want them to do it safely and legally. We know that unfortunately the indoor bar scene is uniquely suited for transmission of COVID because of human behaviors that spread the virus, like loud talking, people being crowded together, people moving closer to talk to each other over loud music, drinking alcohol, which lowers inhibitions and good judgment. Those things can be problematic. We're seeing a rise in the number of young people in their 20s that are contracting COVID because they patronize bars and restaurants in that age group. And we know, as we're learning, that we have to be careful about those things. Customers and staff need to wear masks in these establishments. The customers in particular, except when they're eating and drinking. Otherwise, they're required to wear masks, and that's the best bet to keep everybody safe. I want to make sure that this age group doesn't eclipse other age groups like the elderly, who are more susceptible and higher risk. I will be available to answer questions about the executive order requirements, like the 70% issue. And there's also information on our website for those who wish to get that information that way. Thank you.
Thanks, Barb. It'd be great to have you on the Q&A because those come up quite often. And for those of you watching or listening, don't forget about those delivery drivers too. That's popped up recently that we've been dealing with, that make sure those folks dropping off your stuff are wearing the face coverings, and if they're not, make sure you let their distributor know. We have a lot of resources available for businesses and workers out there at Michigan.gov/COVID-Workplace-Safety. That includes all those industry-specific guidelines I mentioned for every industry that's been named. That certainly includes bars, restaurants, and retail spaces. There are checklists and fact sheets there that you can use. Videos like the one you saw, as well as others, are available there. And we have a lot of the posters that you need based on the executive orders. Certainly, there's more than just the few that you see here, but those no mask, no entry posters, waiting areas. We have some specific for retail on the square footage limitations that are included in the executive orders. So you'll definitely want to check this out and make sure that if you don't have them posted, they should be posted, and you can get those resources from us here in a downloadable, printable PDF format. You can also find information from the Kalamazoo County Public Health guidance to reopen workplaces, as well as the Michigan Economic Development Corporation has set up a wonderful Pure Michigan Business Connect platform that you can use to find PPE, hand sanitizer, plastic barriers, and those other things that you're trying to find for your workplace. Those are Michigan manufacturers, which are wonderful. If you're making those types of things, you can also try to connect your Michigan business through that platform at that same link. We have a My Symptoms app. I talked about health screening a little bit. It's required of all workplaces that you conduct a daily health screening for employees coming in as well as visitors if you are not open to the public. You can use the My Symptoms app to be compliant with the health screening requirements that was created by folks at the University of Michigan in coordination with the Michigan Department of Health and Human Services. It's free. What will happen if you go to that link, if you're an employer, is you'll get a specific employer code. You give that to your employees, and then they set up their account, which links back with you, and they do that health screening questionnaire every single day before they come into work. You can find great resources at the Michigan Safe Start site, as well as those Mask Up Michigan resources at Michigan.gov/Mask Up. Those are created by the Department of Health and Human Services and really jump into a lot of those areas that I already mentioned on how effective and necessary these masks are. And there's other tools and posters there that you can use as well. The MIOSHA folks early on in the crisis created a dedicated hotline, which is wonderful for COVID-related questions. That's 855-SAFE-C19. If you're an employer out there and you have a question about your workplace and things that you may do, in fact, and for those questions we may not get to today, you can give the hotline a call. The average wait time's been about 15 seconds. The average call length's about 4 minutes, 4 to 5 minutes. And this is a great resource to you to talk directly with the MIOSHA experts on things that you need to be doing in your workplace, as well as if you're an employee and you have questions about what's happening in your workplace or concerns, you can call into this hotline as well and they'll work with you. For employers, if it's necessary, they can get you over to our consultation program. We have a great consultation team at MIOSHA that can help you identify and correct things in your workplace. And for employees, if necessary, they'll get you over to the complaint side of the process to move that forward. So just keep in mind as you're working through everything that you need to do in your workplace, which includes creating that preparedness and response plan, to installing those physical barriers if appropriate, to those administrative controls. They are there for you to answer these questions and help you make sure that we're all doing this together and we're doing it safely. So with that, we'll get to the question and answer portion of the presentation.
All right, thanks for all that, Sean. My name is Erica, and I'm going to be assisting with the questions that you all have submitted while Sean is speaking. If you haven't already, go ahead and type in your questions, and we will get to as many as we can during the remaining webinar. So with that, I'll kick it off with the first one. Sean, our first question asks, is it mandatory or a state requirement that employees' temperature be checked when they enter the building to ensure a safe working environment?
So as everybody knows, the executive orders are very specific on the workplace safety requirements. That's Executive Order 161 now, and it includes specific requirements for different industries. So for manufacturing, meat packaging, and casinos, a temperature screen is required before workers come into that workplace. For the others, it's if possible. I would encourage employers to consider that if it is possible, because many low-grade fevers we're unaware of it, or because we work for a living, like everybody, people may come into work even if they have that symptom, just because they don't feel quite right. So if you can, you should, but it's required in those 3 specific industries for sure.
Perfect. And if a worker tests positive for COVID-19 and then overcomes the illness, what are the correct return to work rules?
So the CDC has recently updated their return to work strategy. Now, for healthcare professionals, there's some specific testing and other requirements that you should check out if you're in the healthcare space. But for everyone else, generally, it's a time-based requirement. So you'd need to isolate for 10 days, and you'd have to be 24 hours with a reduction in symptoms without medication and no fever to make sure that you're safe to return to the workplace. And the CDC updates those as the science tells us how COVID is spreading. So you definitely want to refer back to those guidelines as when you're checking that out to make sure you're up to the speed on the latest and greatest.
All right. And who needs to wear the non-medical grade face coverings and who provides them?
Those are required to be provided by the employer, and those can be cloth masks or surgical masks. And anybody in, depending on your workplace, but as we're talking about bars, restaurants, and otherwise, anyone in an indoor enclosed public space has to wear those at all times, unless they're seated and eating in a restaurant, as Barb had mentioned.
All right. If there is an employee who is waiting for test results, are we required to notify other employees that an employee has been exposed but not determined positive yet?
More than likely, if they're being tested, they have exhibited symptoms. So the employer should proceed based on those symptoms and notify other employees that may have been exposed of the potential. Certainly, you have to be in close contact. Close contact's defined as being within 6 feet of someone with symptoms or a positive COVID case for 15 minutes or more.
All right. And how do the capacity guidelines work if we have outdoor seating?
Outdoor seating, I would defer to Randy a touch, but generally outdoor seating is an extension of your restaurant under your same parameters. So you still need the 6 feet of social distance. You still need to limit that capacity to 50% of the seating and follow those guidelines. Randy, do you have anything to add there?
No, I don't, Sean. Thank you.
Or Barb, sorry.
Yeah, I'm going to defer to Barb a little bit probably because our rules are govern the building itself, the interior of the building. So when you do outside seating, unless it's in like an enclosed like tent structure, something like that, but if it's open air, then we just need to make sure that people can, you know, they're going to have free access to get out. So our rules don't regulate the outside of that building. So Barb may have something on the liquor control side that regulates that.
At the Liquor Commission, actually, it's the same. We require indoor seating capacity has to be posted and determined by local authorities, but we don't have requirements for outdoor seating or any sort of formulas to address it.
All right, with that, I will move on to the next question. It looks like we only have a couple more questions in the queue. So again, for anyone who has questions, feel free to enter them into the Q&A tab. It should display as a little chat bubble with a question mark, and we will get to those as they come through. So Sean, the next question asks, what should I do if people are not compliant with masks? Some wear poorly made DIY masks that are made out of thin material, not fitting tightly around the face, gaps around the nose, cheeks, and chin area.
So if the question is coming in as it relates to their customers, certainly businesses have a lot of leeway to go beyond what we've required. So they could attempt to prescribe a certain type of mask, like no gaiters or something like that. It has to be cloth face covering all parts. Our executive order does say it needs to cover your nose, mouth, and chin. And they can deny service. In fact, they're required to deny service if somebody's not wearing a mask and doesn't fit one of the exceptions that's allowed. If a customer refuses, they should ask them to leave. And if they won't, we do not encourage employees to try to engage, or managers or owners to engage in any type of conflict or confrontation with anyone, but consider calling local authorities. So while we have seen some news on resource allocation, on how local authorities may impact or enforce the masking requirement, they do enforce trespassing. When you ask somebody to leave your establishment and they refuse, that becomes a trespassing situation.
All right. And if I am a bar and I have outside seating, do I need to follow the 25% capacity, or do I need to close because of alcohol sales?
So the question is very broad. I think they would need to close as it relates to alcohol sales, Barb, if their revenues are more than 70%, right? Or gross receipts, I'm sorry.
Yes, and just to let you know, we get the question often, what does that mean? We're going by the common definition of gross receipts. That's typically the income from a business as reported on a tax return. If a business is not sure what their gross receipts would include, they might want to check with their CPA or other official who's working with them on their financial records.
And if
that is the threshold. If more than, I'm sorry.
If it is
70% the income is coming from alcohol, then they would have to be closed for indoor seating under the executive.
Okay.
All right.
Thanks, Barb. And Eric, if I could, on the question, the person mentioned the 25% capacity. So in a restaurant, it's 50% of your normal seating, and it, you know, maybe in their formula that means 25%, just based on the layout of their place, but it's 50% of your normal seating.
All right, perfect. The next question asks, do on-campus restaurants and cafeterias need to follow these guidelines?
Absolutely.
All right, and do I need to post the typical mlcc minor posters outside to go with outside seating? Question for Barb there.
Yes, you are. There are requirements about signage being hung in licensed premises. If you hung it inside, that may be adequate. You could also hang it outside if you wish to.
All right. And if you have a mask on, does it affect the direct exposure determination? I.e., two masked people are closer than 6 feet for longer than 10 minutes. Are they considered directly exposed?
Yes, potentially, yes. If that person, so I mentioned it cuts transmission by about 70% is what some of the science is telling us. Obviously, that's not 100. So if we're just using cloth face coverings, that would still be considered close contact as of now.
Okay. And if someone has stayed home because they have one symptom, for example, abdominal pain, can they return when they feel better if they do not have known contact with someone with COVID? Or does the new EO require them to stay home for 10 days?
So under the executive order, and I forgot the number off the top of my head that was reissued that had to deal with the Paid Medical Leave Act, which defined principal symptoms and otherwise. We've been asked this question and we're working on a clarification FAQ.
All right. And how do we control large house parties where people are purchasing kegs or large amounts of alcohol from a store that sells this? Is the store liable for these sales?
I think that as a store owner, this is one of those things where I said, I don't want to take away from Barb, so I'm going to let her answer the store sales question for sure. But we don't want you to just think about what you have to do. We want you to think about what you can do. So I can tell you that having talked with almost every college and university in the state of Michigan and heard some of the plans, they are working very diligently on this issue as it relates to those things on campus where they have some authority or control over those situations. But we know that a lot of students live off campus. And those are areas that we really need to think about and get landlords engaged and get the folks engaged to the point where they're helping to dispel those kind of things from happening. Because when I mentioned the social distancing and otherwise, you know, when we really see the contagion and the spread of COVID, when we get too close together, because like I mentioned, a lot of us have this and feel fine. So we're in a position to spread this without really knowing that we are spreading it. And that makes it very, very difficult. So finding ways to minimize and mitigate those places where we get close together, which is part of the premise of all the rules that you're dealing with for those bars and restaurants and retail, keeping people from getting close together, you know, everybody needs to help in that. So as far as it relates to liability and liquor sales or alcohol sales, I'm not. Barb?
Yes, well, it depends on the detail. A store could be liable for sale, for example, to if it knows they're selling to minors, they're responsible for that. It's possible they could be held accountable for selling to a large party if they're aware of what's going to happen. Not sure how those details would shake out. So stores need to be careful. If they overhear things like that, they might want to think about whether they make that sale. We would have to look at all the details. This could be a thing that would be investigated by police. So it depends on how the details come out.
All right. We have another question. How are we supposed to know an employee is actually showing COVID symptoms? Meaning, what proof am I allowed to ask for?
Well, some of the symptoms are going to be visible, right? So that would be all the proof that you would need. Under the executive order, I think it's mentioned specifically that a doctor's note should not be required because of potentially overloading the system for these types of things. So in large part, it's going to need to be a dialogue and communication between the employer and employee and have some faith.
All right, well, thank you for all those answers. It looks like those are all that we received. So with that, I'll turn it back over to you, Sean, to close things out.
Absolutely. We appreciate the time that everybody took today to kind of check in here and see what's happening. We've been doing a lot of Q&A sessions as it relates to workplace safety, so it's really great to have Barb and Randy to help out with the liquor control and the fire safety aspects of these questions that we've been getting. As we've been moving around the state, we're going to continue to do these, so I would hope and expect you to check in as much as you need to make sure that you're getting all the information that you need. I would encourage you to continue to think about that next step that you can do. If you know of areas in your community, keep in mind that local public health has a lot of authority to also issue orders and other regulations to help minimize the potential spread of COVID. So don't make sure you feel free to make sure that sounds goofy. Feel free to engage with your local public health to talk about concerns that you might have about around campus and around your communities on how things can work and how they can happen. And our goal here, as we've discussed, is to make sure that as we hit these big milestones, all of these young college students returning to campuses across the state of Michigan, potentially K through 12 starting up again, where they're kind of built-in congregation points that we're finding ways to minimize and mitigate the potential spread of COVID in our communities, because it puts lives at risk, it puts our economy at risk, and we just need to take ownership of that and move forward together. So as I mentioned at the outset, don't just think about what you must do to be in compliance. Think about what you can do to help make sure you contain the spread of COVID. And I would ask you to work across any association you're part of, any groups of similar businesses, reach beyond your business groups to talk about the impact that a COVID outbreak is going to have on your community and how it's going to impact your livelihood, the livelihood of all those people trying to make a living in those areas, and the things that you can do together beyond just what you're seeing from the state, or even in some cases your local public health, to really help contain this. This is a big deal, and we need to make it a big deal, and we need to make sure that as we get these potential congregation pieces coming back together, that we're doing everything we can think of to really mitigate the risk that this is going to pose. So I encourage you to think out of the box, to be creative, to do more, and to really be a part of the solution. And I know that I talk with so many that are really working hard to be a solution in this COVID crisis, but we have to do it together, because by the time you find one that might not be on the same page, the potential for COVID transmission in our communities has already gone up. So we got to really, really work together to contain this. And it's going to take all of us, as at Kalamazoo, they would know this. I don't know if they still like PJ, but they're going to have to row the boat in the same direction and to keep those Broncos moving forward. So with that, I appreciate the time, and feel free to tune into the other ones and check out our weekly Q&As. Make sure you go to COVID Workplace Safety and find all those resources, and let's keep pushing forward.